Well, the first thing is I want to thank everybody for joining us today. I mean, my intent in the next few weeks is to have a regular meeting like this. And hopefully people that watch it will find it very informing and maybe interesting for that matter. I mean, the idea behind it all is that we have put in one hell of a year. And I know the doctors that are with me today have been in the middle of it. They've had the toughest end of it, but the rest of us now is reaching a point where we see a light at the end of the tunnel. I see optimism on the street on a regular basis. And but there's still areas that we have to cover. We know we're still in the middle of not in the middle of the epidemic, but we are in the epidemic. And today, especially, I am excited about it. Like I said, in the next few weeks, we're going to have more of these meetings and we're going to see what happens from here on in. The important thing is that, before we open up Gallup to the rest of the world, we need to open up Gallup to ourselves. And with that being said, Chewy Morales is with us, our chief of police, our fire chief. And anyway, I'll leave it to him to do the introductions.
Thank you, Mr. Mayor. Again, for the viewers out there, my name is Chewy Morales, and I'm the fire chief of the Gallup Fire Department. I also am the city's emergency manager, and I've had some great opportunity to work with our leadership in our community from our different hospitals. And I can tell you these leaders from these hospitals have really made an impact to our community. And I would like to introduce to you all Dr. Jonathan Iralu. He's from IHS GIMC. I would like to introduce Jennie Wei. She's also a doctor from GIMC, IHS Hospital. And I would like to introduce to you Dr. Valory Wangler. She's from RMCH Hospital.
Thank you, Chewy. So we'll get right into it. I mean, one of the first questions that I'd like to ask the doctors is, what do the numbers in the governor's report mean for Gallup? When can we open more? And I'll start, if you don't mind, I'll start with Dr. Wei, if you wouldn't mind.
Yeah, well, thanks so much for inviting us. This is really great. And I just want to say before I answer that question that I've just been so blessed to be able to work with so many people in the community, Chief Morales, Mayor Bonaguidi, Dr. Wangler, Dr. Iralu. It's been an incredible opportunity despite how horrible COVID has been. It's just great to see how the community has come together to really make the best out of this situation that we can. And I've really seen a lot of positive things, honestly, come out of it. So I just am so honored to be a part of this community, and thank you for inviting me. So I think the governor's numbers, and I will say the numbers here in Gallup, reflect something hopeful. You know, we saw a big spike here back in April of last year, and we saw another spike here in the late fall in November and December with cases of COVID. But what we're seeing now is a little bit of a dip, which is really promising. We think that might be because we're hopefully not, lessening what we know works, which is social distancing and masking, but we're also really all in about trying to make sure that our community is vaccinated with the COVID vaccine as quickly and efficiently as possible. And so I think a lot of these things are really working, and we're seeing decreased rates of COVID, not just reflected in the governor's numbers, but also in our hospital's numbers here at GIMC.
Oh, that's encouraging. Dr. Iralu, pardon me would you correct me on how to pronounce?
No worries. Yeah, my name is Dr. John Iralu.
Iralu.
But if you really,
what do you make of the numbers of the governor's report?
Oh, I'm rather excited. We had, as Dr. Wei points out, things looked really bad approximately 3 months ago, and we've seen an improvement. I would have to say that we are not completely out of the woods yet. We are just barely getting the vaccines rolled out to help protect the community of Gallup, McKinley County, and the Navajo Nation. And so while I'm somewhat optimistic, it's guarded. We probably talked a little bit later in the call about some of the new variants in the virus that are coming our way and how we need to be careful. So I have some cautious optimism about the way things are going. I hope it keeps on going in that direction.
Do you think you could call them to try to get an appointment? Yeah, okay, so
Thank
let
you,
me
Dr.
call
Iralu.
walk-in clinic,
Dr.
and then
Wangler.
once you have that appointment, you can call iClinic.
Mayor, I think that Dr. Iralu said it perfectly. I think cautious
Okay.
optimism is exactly the right phrasing for where we're at right now.
I'll call you right back, okay?
At RMCH, we
Okay.
certainly have seen a decrease in the
Perfect.
patients
All
requiring
right, see ya.
hospitalization. We have significantly less COVID patients in the hospital than we did in November, December, early January. But it's still there. It's still in our community. As Dr. Wei pointed out, the county numbers are looking much better. The last two reports I saw, we had 12 and 13 cases reported in the county, which is down from 120 a day for a while there. So that looks great. The cautious part, though, right, is that if you look particularly at the map that the mayor puts out with the red, green, yellow counties, to get down to that 5% where we're able to really say, hey, it's safe to start reopening things. We still have a long way to go. We're still at 20% test positivity in McKinley County. And so to get down to that 5%, we still have a lot of work to do. So I think that we're on the right track. I think that the community has done a really phenomenal job of getting vaccine out. As was mentioned, efficiently, effectively. We've vaccinated a lot of people, and New Mexico is really leading the country. We're consistently in the top 3 for having gotten vaccine to patients efficiently, just as quickly as we can get it. So I think that initiative is going really well. I think we'll continue to see improvements, but we're not there yet. We really have to keep the masking, keep the distancing, keep with what we're doing right now so that we can see that trend continue.
Mhm. Well, I'm glad, I'm glad that you're seeing optimism, and I am. One area that specifically what you got me was going to church on Sunday. Way back in April, there was nobody in church, and then gradually more people came, and this past 2 or 3 weeks, it's been an enormous amount of people that are coming, just specifically church. So I think, well, that's got to be an optimism, and I appreciate hearing it from you too. Testing, are we still doing testing? Is it important to do testing? This time I'll start with Dr. Iralu.
Yes, testing is critical. You need to know if a person who has symptoms, just whether they just have allergies or whether they have the virus, so you can stop transmission. If you don't detect these cases early, a person could spread them to their family, coworkers, and friends. So it's still critical to do testing. So both hospitals, and Dr. Wangler can fill us in on this on her side, but we do testing at the Gallup service unit. There's a drive-up test line. And they do the swab testing. You can get an answer in a couple of days usually because of the technology that's being used. So strongly urge people, especially with symptoms, to get tested. Also, if a person is a contact of a case, it's usually recommended that they get tested right away. So testing is still really critical. So please, if you're a American Indian beneficiary, it's very important that you know that you can come to Gallup Indian Medical Center to get some testing like that.
Yeah,
Dr. Wangler.
Yeah, to jump on from the RMCH side, exactly. Yeah, we're doing the same. Our drive-through testing continues at our urgent care clinic. It's
just in
quick,
case, can I
efficient.
actually give you a
Early on, we had long
my
lines of
cell
people
is
waiting.
505.
And that's not the case now. Those numbers are down. So it's 5 to 10 minutes and get swabbed and be on your way. It takes a couple of days, as Dr. Iralu said, to get results back. But it's really important that you know your status. It helps you protect your loved ones and those that you're in contact with. So come test. We're absolutely happy to test you. They're at the drive up anytime it's convenient for you.
Oh, you'll call me?
Dr. Wei?
Okay, perfect. That would be great. And then I will call her and let her know.
I always
Okay, thanks
echo
so
what
much.
Dr. Iralu says. He's always correct. But yes, absolutely. We are actually starting to see people coming in for tests not as frequently as we were before. So we still do encourage people to get testing, just because a lot of us are really pushing to get the COVID vaccine out. Still, please come. We have our testing sites open during the day, Monday through Friday. Is it still Saturday as well, Dr. Iralu? No, just Monday through Friday.
No, no, it's not now.
Okay, Monday through Friday, 8 to 4-ish. So yes, if people have symptoms, please do come in to get tested. It's important to know if you have it, so we can continue to do the important community mitigation strategies, which is to isolate if you're positive, or isolate if you have symptoms, for at least 10 days. So that's super important.
Well, the symptoms, I mean, myself, I had the virus and I had the slightest symptom, and that was like a slight cough and a tickle in my chest. And fortunately, the people around me said, well, you need to get tested, because at first I didn't think it was that serious, but I did get tested and it showed positive. So people are encouraged, yeah, if you feel just different, I mean, it's important, go get tested. Do it, get it right away and find out. So the CDC has changed its statements about masks. And now I'm reading that they want us to double mask. I mean, I have a hard time with a mask as it is, and a double mask. And this time I'll start with Dr. Wangler.
Yes, sir. Thank you, Mayor. I thought that was really, really interesting news as well. So the idea here, so what they did was some studies that showed that like medical surgical masks that you'll see a lot of people wearing, when worn alone, they don't get that tight seal. So there's room for air to come in on the sides. There's a fair amount of room and a fair amount of space for those COVID particles or infectious particles to get in through that mask. And when they did that study, they found that if you put a cloth mask over that, it really helps reduce that transmission. So from about 63%, I believe Dr. Iralu probably knows these numbers better than me, about 63% protection with the single mask to well over 90% with that double masking in place. So as with all things COVID, things change all the time. I was honestly a little bit surprised to see that information myself, but I've taken it really seriously. We got that word out to our staff. We're trying to get the word out to the community that it looks like there really is significantly better protection from either a multiple layered mask. So some of the cloth masks do have several layers of material in there, and those look to be more protective as well, or with a medical mask and then a cloth mask over.
Dr. Wei, like anything to add to the double masks?
Nothing to add to the double mask. I think that was a perfect explanation by Dr. Wangler. There is something called a KN95. You guys might see these out on the streets as well. For the KN95s, though, they really do feel like they feel like there's enough of a layering such that you just need to wear the KN95. You don't need to actually double mask with this. So if you're just wearing the KN95, that's okay. Otherwise, wear that surgical mask, and then the cloth over it is going to get your best protection. I also, a lot of times when we wear the mask, I don't know if this is a problem for Chief Morales and Mayor Bonaguidi, Dr. Iralu, if you guys are wearing glasses and you see the kind of fog, that means that air is escaping and that air is coming in. And so that's why they're really encouraging people to wear the surgical masks or the N95s, which have the nose protection there, where you really kind of push that in to prevent as much air from coming in and coming out.
Dr. Iralu, what do you? He's going to put his mask on. Doctor, you're on mute. There you go.
Yeah, so sorry. So I can demonstrate quickly. You worry about the air blowing out the sides, can come under the chin or up under the eyes, as Dr. Wei points out. So the recommendation is just pull a second one on top like this. This adds tension and it makes things snug against your face better. The other option the CDC says is to tie knots in the side here to add tension to the mask, and also to do a special tuck underneath. You can read about all this on the CDC webpage.
Oh, thank you. Yeah, I can identify to everything, and my glasses steam up, and yeah, all of a sudden I noticed my skin is real soft. I think from wearing a mask all these months. I don't know. hopefully that's good. But anyway,
Mayor, did you want me to address the question about the quarantine? I know you were concerned about that.
yeah, that was the next question.
I can hit on that. So there are two terms that you all need to know the difference between. If somebody has COVID, we call that isolation. And we want them to isolate from the public for 10 days if they're simply an outpatient with mild disease. And it's 20 days if they have more serious disease requiring a hospitalization, or if they are a person who is immunocompromised. So that's isolation, a different topic from what you want to know about. Quarantine is how to keep safe once you've been exposed to COVID. For instance, say you were exposed to COVID in the home or in the workplace, you might be asked to quarantine. So the classic quarantine, the one with the most science behind it, is a 14-day quarantine. And you can eliminate about 99.5% of cases if you do a 14-day quarantine. The CDC recently said that if you're in a situation where you're not being, you don't have to be extra careful. In other words, say you were in a town which didn't have a whole lot of COVID, you could shorten the 14 days down to just 10 days. And if you were really feeling gutsy and you wanted to cut that quarantine down even shorter to 7 days, you could do a test, one of those swab tests at day 5. And if that was negative, stop at day 7. Here in Gallup, McKinley County, and the Navajo Nation strongly recommend that you stick with the 14-day quarantine to stay safe. We have a lot of disease here. There's a lot of morbidity and mortality. Really urge you to stick with 14 days. That's the message that we're giving from the Indian Health Service. So it's not the right time to kind of crunch down and shorten that quarantine period. So that's all I wanted to say about that.
Appreciate that. Yeah, the quarantine, for me, the quarantine was worse than the virus, but that was just me. So, Dr. Wangler, is there anything you'd like to add to that?
I don't think so. I think Dr. Iralu did a really good job describing that difference. Just to relate to your story, Mayor, I also had COVID back in April, and you're right. That quarantine period is a challenge, but it's such an important thing to do for your family, for your friends, for your loved ones. So even though it's hard to hang out by yourself for that long, it's a really important thing to do.
Dr. Wei?
Yeah, the only thing I'll add is a lot of times we'll see folks have some symptoms that could be consistent with COVID. Like you say, kind of you're feeling funny, maybe some coughing, some trouble breathing, fevers, things like that. They come to get tested, and the test results don't come back for a few days. It's important in that time for you to just assume that you may be positive and to isolate in the 2 or 3 days that you're waiting for that test result. I can't tell you the number of people that we've called to tell them the test result, and they said, "Oh shoot, I was just at Walmart all day yesterday." So it's really, really important that we protect ourselves and protect our family and community. And if we have symptoms, it's such a bummer, but staying at home and learning how to be okay with being with ourselves for a few days.
I think that's a very good point. I mean, yeah, you think, well, I'll get tested until I find out I'm negative in your mind, but you could be very positive and pass it on for sure. I got a question that is not listed with you. I hate to do that. I shouldn't do that, but I got a question. If you've had the virus and you've gotten over it, is there immunity at all? I mean, that seems to be a question that, well, my daughter and I seem to have going back and forth. She seems to think that there is a certain amount of immunity, and what I'm thinking is that there is no immunity. You can still catch it again. So if you don't mind me asking that question, I'll start with Dr. Wei this time.
Yeah, so what this virus is a novel virus, and we only know of it for about a year now. So we don't know all of the answers yet. But what we do think is that it's pretty rare to get reinfected within the first 90 days of when you've been infected. Pretty rare to get reinfected within 90 days. So actually here at the hospital, if someone was tested positive last month and they come back in again and they test again, we don't think that that's a reinfection. We think that that's just kind of lingering, not a new infection. It might just be kind of lingering, and the test is not perfect to detect a new infection. So beyond 90 days, though, we're treating people beyond 90 days as if they never had it. So if you come in again, you were like Dr. Wangler, who might have been positive last year. If she has symptoms again, we might say, hey, it's good to get tested and maybe just consider yourself positive and isolate again, just in case. We just don't have enough data yet. But we think for the first 90 days, it's extremely rare to get reinfected.
Oh. Dr. Iralu?
Yeah, exactly right. There is scientific evidence showing that immunity, antibody levels that are protective against COVID in Iceland went out 4 months. Another study showed 6 months, but we are already seeing people who have a second infection with COVID after that time period. So having the illness once is not like a vaccine. It doesn't have long-term protection. So be aware of that. After the 90-day window, if someone starts to cough, get those body aches, loses their sense of smell, et cetera, they could have COVID a second time.
Dr. Wangler?
Happy to report that it sounds like you and your daughter are both right. There's some protection, as said, very good protection in those first 90 days, and very long term. We don't know what happens yet, but we do know that there's some risk for reinfection after those 90 days. Where I see this question coming up really frequently now as we move into the vaccine phase is I'll frequently hear, hey, I had COVID back in August, do I need to get a COVID vaccine? And the answer is yes. So we know that, as Dr. Iralu said, that vaccine protection is going to be better in the long run. You do have some risk of reinfection. So even those who have had COVID should be planning to get COVID vaccination just as quickly as it's available to them.
Okay, thank you. Next question basically is, what do I need to provide to my employer about COVID? Well, my business, I mean, we do have a number of employees, and we've been fortunate. We haven't had, I've had cases where they call up and on a Monday, he's like, you know what, I may have the COVID and I'm going to get tested. But what kind of reports do we have to have as an employer from the employees?
You want me to take a stab at that one? So what we'll traditionally do if somebody comes in with symptoms suggestive of COVID, we'll actually give them paperwork giving them time off from work. And then we instruct them to wait for the test and to isolate. So we basically assume they're positive when we first see them, and it may take a while for those test results to come back. But that paper is one that can eventually be given to the employer to document, what happened. And then if someone has the COVID illness and it's confirmed, they can often use that form that says this man needs or this woman needs to isolate for 10 days. That form can be used, or you can obtain a form from a provider later on once you've recovered. But that's sort of what should be given to an employer to let them know what's happened to them.
Mm-hmm. Dr. Wangler.
That sounds exactly like our process here at RMCH. I have nothing to add on that one.
No. And Dr. Wei?
Yeah, the only thing I'll add is a lot of times we have folks ask like, hey, I need to get another test before I can go back to work that shows that it's negative. And I think the most important thing to point out there is we are following CDC guidelines, which says you really only need to isolate for 10 days. Unless you had really severe disease or were in the hospital, in which case you'll get a different letter that might extend it a little bit. But once you complete that 10 days and you're feeling better, you can go back to work. It's safe. You're not going to infect anybody else. And oftentimes those repeat tests, they may show up that you're still positive, but what we know is that beyond 10 days, you're not able to actually find live virus that can infect other people. So we've actually seen positive tests out as long as 2-3 months, from their initial test, but that doesn't mean that they're infectious. they can still go back to work after they're feeling better and they don't have fever and their symptoms are better for 24 hours.
Thank you.
So I would ask employers not to ask your employees to get a repeat test because it's just not accurate in those first few weeks.
So, well, say in such a case that one of the employees all of a sudden gets sick during employment, and then she goes and gets tested and she's tested positive. What about the other employees? Would they, should they quarantine themselves in the next 2 or 3 days and then get tested? Okay, I'll start with Dr. Wangler this time.
Yes, sir. And I saw Dr. Iralu unmute there, so I'll let him jump in as well. But that's exactly right. So anyone who's been in close contact with that individual will need to, quarantine, be tested, make sure that they're following the recommendations. My recommendation in those cases is that they call our COVID testing clinic for some specific advice, sort of based on how much exposure they've had to that individual, but they are very likely to need to quarantine, test, as Dr. Iralu described that process earlier.
Yeah, that's a no-brainer. If you're exposed to a bona fide case of COVID-19, that's an automatic 14-day quarantine for the person in the community. There are rare instances for instance, in a hospital situation where you had somebody doing COVID care and you were extremely short-staffed because of the pandemic and somebody just had to get back to work, we might possibly allow someone to be observed and as long as they wore their mask, they're working on a COVID unit. But that's an exception. In the community, it's 14 days. You got to stay home. Don't go on vacation. Don't go to the restaurant. Don't go to church. Stay safe.
Dr. Wei?
Yeah, it's really tough because it's hard to know who around you is infected. And so that's why these mitigation strategies that we talk about should be universal, where you're trying to stay more than 6 feet away from people, making sure that everyone wears their mask. As long as you're doing those things, and sometimes it's impossible given people's employment and circumstances, but as long as you're able to stay that distance, you may not be considered a close contact. As if you haven't been within 6 feet for more than 15 minutes of the positive person. But so as long as we can try to make our workplaces as safe as possible, knowing that there might be a positive case pop up here and there, that'll be the safest in the long run because it means that your staff won't have to all quarantine for 14 days and be out of work. So it is challenging because we have limited space, et cetera. But if people can work from home, if people can distance themselves, those are going to be really important to invest in now to prevent, hours lost.
I know most businesses, like our business, basically, when the employee comes in the morning, the first thing you do is check their temperature. And I would imagine the temperature is probably one of the first signs of the virus. Am I wrong? Or but so far, all my employees, every time they've come in, have been in under 98.6 or what is it? Yeah, something like that. So.
Yeah.
Go ahead, Dr. Wangler.
No, I was just going to say, I think it's a good strategy, but it's also it's challenging this time of year too, right? Because you have your staff coming in from the parking lot. It's 20 degrees out when they come in for work, and so even those that might have a fever, sometimes that's gonna read low for a couple of minutes until they kind of get back up to temperature. So here at the hospital, we primarily rely on really close questioning of symptoms. So when you walk in the door, you'll be asked, have you had any one of about 12 different symptoms that we ask every single person that enters any one of our buildings. So I think that the combination of, understanding, temperature monitoring, keeping an eye on that, but really closely watching those symptoms at the same time, I think that's the best approach.
Mm-hmm. Mm-hmm. Dr. Iralu, anything to add to it? You're on mute.
Nothing extra. No, thanks.
Okay. Let's move on to the next question then. There are news reports of new strains of COVID in our country. I guess the African COVID and then the English COVID. This time we'll start with Dr. Iralu.
Sure, I'd be happy to touch on this. So the virus that causes COVID, SARS-CoV-2, has the ability to mutate, and it has recently done a lot of mutations on the tips of those spikes that are on top of the virus. And those are of concern because that's the place where the virus attaches to the human cells and can cause infection. It's also the place where the antibodies from the vaccine bind on. So if there's a mutation there, you might see increased infectivity, meaning it's more contagious, basically. And you also could possibly see more severe disease. And then lastly, you might see that the vaccines don't work so well on this. So the ones that first caught our attention in December were the so-called British strain, or British variant of COVID-19, and then which is now in America. It seems to be doubling in numbers every 9 days. So it's going to probably become the dominant strain, and it may eventually make it to Gallup, New Mexico. There's also South African variant, which has shown up in a couple of states in the United States, not as widespread as the British. There's a Brazilian, there's a California variant, but the thing to know about these is the focus on the British for right now, since that's circulating. It appears that that it's more infectious, so maybe about 50% or more infectious than the conventional last year's strain of SARS-CoV-2. But it does have a slightly decreased protection from the vaccines that are given, but it appears that the vaccines are going to work. So we still need to have some more information about what viruses are circulating in New Mexico. Nothing big has been published. We know the British variant has been detected in New Mexico, but we want to see if it's circulating widely. There are some public health officials in the Four Corners area who are working on this exact same topic. So you'll know within a few weeks, I hope, about what we call COVID virus sequencing, and do we have those new variants here in this area? So wait a little while, we'll know the answer.
Dr. Wangler.
Yes, those are the exact same two strains that I have my eye on as well. I think that's true of a lot of the medical community, and for exactly those reasons. So the UK variant does look like it is more transmissible, meaning for every person that's infected, they're more likely to infect more people than the original strain. And then the reason that the South African variant, which again, fortunately we haven't detected, is getting so much attention, is that there is some concern about how different vaccines will work for that virus in particular. They've seen that for one of the vaccines, which is not the one that we're using here locally, it doesn't look like it protects very well against that strain. So I think, this is something that we're going to be watching for the long haul. This is what viruses do. This is why you need a new flu shot every year. Viruses, part of their makeup is to mutate and to try to find ways to get around the immune system. So it's going to be something to watch really closely. I think that we'll see a lot of variants come out over time, and we'll have to really keep a close eye on which ones to be most concerned about from a vaccine perspective, from a transmissibility perspective, from which ones cause the most severe disease. We're going to be hearing about this for a long time.
Dr. Wei, you're shaking your head. I mean,
yeah, gosh, these viruses are so smart, but we're smart too. And we know what works to prevent spread, to mitigate community spread, et cetera. So I think we need to continue doing the things that we know work to prevent the spread, and then prevent it from getting smarter and being able to mutate in ways to cause more harm. So we're smart. They're smart. I don't know. Dr. Iralu has a lot of respect for viruses and infectious diseases, but don't you think we're doing okay with fighting it?
I think we're doing a lot better than we were 11 months ago.
Right.
I'll tell you what, as an individual, not a doctor or medical field, it makes me feel good, confident that I had 3 people here that have been with us for the whole year and have fought the virus at tooth and nail. and I'm constantly studying the future, for the citizens of Gallup, and of course for the citizens of the Navajo and Zuni reservations, for that matter. That leads to the last question, basically, and I think we can probably somewhat wrap it up unless there's anybody else. But this is a flu season, and we're getting. I mean, there's notices out. Okay, you should be getting flu shots too. It's like, wow, I'm getting vaccinated in every direction here. How serious is the flu, the regular flu that I don't know, every flu has a name, whether it's Chinese or African or whatever, but how important is it to get flu shots? We'll start with Dr. Wei this time.
Yes, I think that every year prior to COVID, we've known that if we vaccinate more people with the flu shot, we see less flu in our hospitals and we see less severe disease in our hospitals. It's the same principles that we're hoping work with COVID. I think one of the reasons why we're seeing fewer cases of flu this year is because the same things that we've been doing for COVID also work for flu. So socially distancing, wearing your mask, trying to avoid being indoors with people who are unmasked, et cetera. So I think that's a lot of the reason why we're seeing fewer cases of flu, even though I don't know the exact numbers, Dr. Iralu might, even though we may not have done as great a job with vaccinating for flu this year, we are still seeing fewer cases. And I think that's because of the other strategies that we've implemented for COVID.
Dr. Iralu?
Yeah, we did do pretty well with vaccinating for flu. We had drive-up flu vaccines, I believe, at both hospitals. So we did rather well, but this has really been the answer. And the 6 feet distance, it works for both viruses beautifully. I want to point out that you don't want to get a flu vaccine or any vaccine within 2 weeks before or after getting a COVID vaccine. So you need to have a 14-day interval there. So don't get a flu vaccine on Monday and then go in Wednesday for the COVID shot. They'll turn you away. You have to have a 14-day interval there.
Well, that's a good point. I didn't know that. Dr. Wangler.
Totally agree. It's been a light flu season, and that's clearly because everybody's staying home, wearing their masks, staying their 6 feet apart. And we've seen that for other illnesses that often land people in the hospital as well. With that said, we made a really strong push for flu shots this year for a very specific reason. We felt confident that if someone were to get COVID and the flu at the same time, that could really be catastrophic, right? That's a lot of infection for your body to be having to deal with at one time. So that's the reason we've been pushing hard on flu shots. And fortunately, it hasn't been a bad flu year. I think that if it had been a year where we were dealing with a lot of flu on top of a lot of COVID, we would have seen our hospitals, overwhelmed, our ERs backed up. It would have been a big mess. So I appreciate the work that everybody did to get their flu shot, and now to move on and get their COVID shot. And totally echo everybody's input that the masking, the social distancing has been key to keeping us safe from COVID and also certainly from the flu.
I got, next week we'll be talking about the vaccines, but I do have a question. If you've had the virus, is there a time period that you should wait before you get the vaccine? Okay, we'll start. Dr. Wei is shaking her head again, so we'll talk to her first.
Yeah, well, we're definitely recommending that people wait to complete their isolation. So if they have the virus, to wait that 10 days at least, sometimes up to 20 days if they had really severe illness. So wait that time until you're feeling better from the virus, and then after that, it is safe to get the vaccine, because we have a limited supply. And we do know that, as your great question earlier, is there some immunity after you get the virus? We do think, like we said, it's very rare to get reinfected within 90 days. So if you were reinfected within the last 90 days, you likely are protected. And so you don't need to rush to get the vaccine if there's not any supply right now. But I think, as we've all said, if there is an opportunity for you to get the vaccine, you should get it. If it's being offered to you, you should not say no. And it is safe to get after you're out of your isolation period.
Dr. Iralu?
Yeah, the same idea. You may choose to wait as long as 90 days. Don't wait longer than 90 days, and you can get it done as soon as you're done your 10 or 20-day isolation. Whether you've been an outpatient, that's 10 days, or those inpatients are 20 days.
Thank you. Dr. Wangler?
My GIMC colleagues have said it perfectly. I think that's exactly what we're doing here at RMCH. Nothing to add.
Well, thank you again. I mean, this has been informative to me. Hopefully it's been informative to anybody that's listening. Hopefully a lot of people will be listening. I say I plan on having these meetings somewhat on a weekly basis. Again, I reiterate the fact that before we open up Gallup to the rest of the world, we need to open up Gallup to itself. With that being said, basically, I'll get back to Chewy. Chewy, I'll let you wrap it up for us.
Oh, thank you, Mr. Mayor. Just to wrap it up and maybe to give our viewers one last little piece. As you know, the state is following that health metrics as far as red, yellow, and green, and us being currently in the red. What, for some people having a hard understanding of, us being in the red, what's the difference of the cases versus the positivity rate, if you get what I'm saying? For us being in the red, you've got to have a rate of greater than 8 cases greater per 100,000 inhabitants, or 14 days of greater than 5% positivity rate. So I know that can kind of get jumbled up and kind of confusing for people. I was wondering if you can maybe break that down a little bit.
I can take a quick stab at that. So what we don't want to happen is what happened in the spring and then also November, where you have people lined up to be tested. Let's say there's 100 people lined up, and if 25 of those 100 people end up having a positive test, that means you have a positivity rate of 25%. That means that every 4th person you see in that line has COVID. That's a bad situation you don't want your state to be in, or your community like Gallup. What you want to see is to have a positivity rate less than 5%, meaning you sent off 100 people came in for testing for whatever reason, and only 5 of those 100 turned out to be positive. That means you're in good shape. Things are getting better for your community, and we're not there yet. Dr. Wangler said 20% for the Rehoboth side of the street, and Gallup Indian Medical Center in the same ballpark, around 20. We're not there yet, so we're still up in the red. So look at that percent positive rate. It is nice to see the curve kind of go up for Gallup and then drop like this, in recent weeks. But look at that positivity, test top positivity figure. That's the most important one. Magic number's 5.
The only thing I'll add is,
Go ahead, Dr. Wei.
Chief Morales, is that we often, our case rate, which is the absolute number of positive cases we see per day, kind of does this. Well, what's happening at the bottom there? That's Saturday and Sunday. So just because we're not testing, we may not have a lot of positive cases that day, but that doesn't mean that 20% of our residents in McKinley County are still carrying the virus. So we might not, so that's why the percent positivity is so important.
Thank you. Thank you for explaining that. I think everybody was wondering, as far as, and when we're going to get to the yellow, right? That is, as you mentioned, we still got some ways to go, and I think we still got the community, to everybody to do their part, and I think we're going to get there, and hopefully we'll get there soon, and maybe even to the green. So keep our fingers crossed. So, Mr. Mayor, that's all I have.
All right. Well, again, thank you for participating with us this week. And I invite you to again for next week when we have our second meeting. We'll discuss the vaccines next week. And I think that'll be a very much of an interest to everybody, because the vaccine, like I say, everybody's optimistic and things are going well. So hopefully things will get better for sure. But with that being said, I think I encourage everybody to wear their masks, double mask if you can. I don't know if my ears can take that much pressure. my ears are beginning to feel like my dog's ears are starting to flop over. So anyway, thanks again for joining us, and we'll see you all next week. Thank you.
Thank you so much.
Thank
Brian.
you.